Cleaning your ears, it's something we all need to do from time to time, but are you doing it wrong? Could you actually be causing damage? Let's find out. So you might think that earwax is dirty and needs to be cleaned, but actually it's got antibacterial and antifungal properties. It helps protect the ears from things like dust and dirt and even little insects. Eek, that's not a nice thought, thinking of them climbing inside your ear. So wax can be quite important, and your ears are really clever. They've already got a very special cleaning system. Kind of works a bit like a conveyor belt. So all these bits of dust and dirt get trapped in the wax, and that gets pushed through the ear canal, and as we chew and as we talk, that helps that conveyor belt come across so the wax can just flake off and leave the ear. When you have got a bit of an itch, or you even might see a bit of wax, it's really tempting to reach for something like a cotton bud, also known as a Q-tip, and try and get that and clean the ear. I haven't even got a cotton bud to show you an example of because I don't buy them, because you should not do this, and also they're terrible plastic, bad for the environment. But what happens is when you use that cotton bud and pop it inside your ear, you are doing the opposite of that conveyor system. So you're pushing the wax back into the ear, forcing it into a big hard lump. Sometimes it can cover the eardrum, sometimes it can burst the eardrum. You're risking giving yourself infection as well as damage, and actually you're probably making that wax much worse. So you know you're not meant to use earbuds, but did you know why? This is why. Stop doing it. Some people are prone to get a bit more of a waxy build-up. It's just genetic sometimes as you get older. Some people have got kind of eczema, dry skin conditions that can make it worse, or wearing things like in-ear bud, headphones, or hearing aids. That can all make you more prone to have waxy build-up. And if you do have this, it can affect your hearing, it can be painful, it can even cause that kind of buzzing or ringing that we call tinnitus, and it can cause vertigo, so that sensation of spinning and moving. Did you know that vertigo isn't actually the name for a fear of heights? That's called acrophobia. Vertigo is just one of the symptoms you get if you are stood on the top of a tall building and looking down. You get that spinning sensation. So just an added extra bonus point of information for you there. So if you do need to remove this earwax, you now know you're not allowed to use the cotton bud. So what should you do? Well, I would recommend the best thing to do is to use eardrops. Go and speak to the pharmacist, because there's a few different varieties. You can have kind of olive oil eardrops, almond oil eardrops, you can get sodium bicarbonate. There isn't any evidence that one is better than the other. You might want to try a few, see what works for you. But actually, when I'm speaking to patients, a lot of people probably aren't using the eardrops properly. So you need to use them about 3 or 4 times a day for about at least 3 to 5 days. But actually, it can take up to kind of 3 weeks to completely clear that wax, depending on how impacted it was. So I've got some here. This is called Otex Express. It's a good one to try. You can get it on Amazon. I'll leave the link in the description. And what you need to do is make sure it's warm, well, kind of room temperature at least, before you put it in your ear. And then you've got to lay down on the other side. So if it's your right ear that's blocked, you've got to make sure you lay down. So it's probably easiest to do it on your bed, like when you wake up in the morning. Lay down on the side. And if you can, with the other hand, pull your ear up and back, and then pop the drops in. And then the key thing to do is you've got to stay like that for about 10 minutes. So don't move, don't be tempted to get up, do anything else. You've got to stay like that, let the eardrops do their magic. Have a bit of tissue at the ready, because when you then sit up, it might dribble out with a little bit of wax. You may not see the wax come out, but hopefully it will be softening that wax and getting rid of it. And obviously you might want to do the same on the other side. So 10 minutes laid on your side, that's the best tip for how to remove your wax properly. There's loads of other things that are advertised for using to get rid of your ear wax, such as a bulb syringe. I think probably try not to do this, because anything again that you're pushing inside your ear is more likely to break the conveyor belt system. The hoppy ear candles, there's not great evidence they work, and they can do damage. A lot of GPs used to do ear syringing, and a lot of patients still want that happening. Some GPs may still offer ear syringing, but again, it can, because it kind of forces water into the ear, it can even damage your eardrum, or if you get risk of infection. So it's not ideal either. If the drops aren't working for you, then the next best step would be microsuction. This is really fun actually to do. When I used to work in ENT, I used to quite enjoy it. So it's just with a tiny vacuum cleaner type of thing, which sucks out the wax. And some GPs do that, but not many. And you may be able to be referred to the ENT, the ear, nose and throat doctors at the hospital, or you may have to pay privately to get that done if the eardrops aren't working. So that's it. So my recommendation is don't put anything in the ear. Try different sorts of ear drops, speak to the pharmacist, and make sure you're doing it properly, laying on your side for 10 minutes. Hope that's helped. Have a look at my other videos for lots of other tips and advice for all your health needs.